Welcome to HESI A2 exam practice test. Our topic today is professional practice. Use the link in the description to download the app on the App Store for free practice tests. Number 1. When do the career opportunities for nurses increase? A. When their education levels increase. B. When they get older. C. When they get married. D. When they work in the area of research. The correct answer is A. When their education levels increase. Explanation. A nursing degree will allow you to pursue a variety of career options within the field. In general, the career opportunities for nurses increase as the education level of the nurse increases. In other words, more education can result in better job opportunities and higher pay. In addition to working as a general duty or staff nurse, a nurse may work as a private practice nurse, home health nurse, midwife, or anesthetist. Nurses can focus their careers on teaching others by becoming educators in nursing programs. Number 2. What is not mentioned as a characteristic of a good nurse? A. Accountability. B. Honesty. C. Creativity. D. Dependability. The correct answer is C. Creativity. Explanation. A good nurse is a team player. Nurses should be able to work well with their peers. The best nurses are honest, dependable, responsible, and accountable. They are capable of following directions and managing stressful situations. Nurses must understand that they are responsible for the well-being of others, and they should avoid abusing substances that could alter their decision-making ability. In other words, nurses should avoid drugs and alcohol. Nurses must be able to care for all patients, regardless of gender, race, religion, or other individual characteristics. Nurses must also be able to control their temper. Patients can be disagreeable, and colleagues can be frustrating, but nurses must manage their emotions to perform their job effectively. Number 3. Which programs do nurses have to complete to be considered generalists? A. Diploma programs. B. Baccalaureate programs. C. Associate degree programs. D. Computer programs. The correct answer is B. Baccalaureate programs. Explanation. Graduates of nursing baccalaureate programs are considered generalists. These nurses are equipped to work in a variety of healthcare environments. Nurses with a baccalaureate degree can fill many roles, including caregivers, educators, and consultants. While technicians care for individual patients in a structured setting, a generalist may care for groups of patients in unstructured settings. Number 4. What does a nurse have to obtain to become an educator in nursing programs? A. A master's degree. B. A baccalaureate degree. C. A doctoral degree. D. A Doctor of Philosophy degree. The correct answer is A. A master's degree. Explanation. Obtaining a master's degree prepares a nurse to become an educator in various nursing programs. A master's degree also allows a nurse to become a researcher, manager, nurse practitioner, or administrator. Doctoral training allows a nurse to earn degrees in education, nursing science, nursing, and philosophy. A nurse with a doctoral degree can become an educator in undergraduate or graduate nursing programs. He or she can become an advanced clinical researcher, consultant, or independent practitioner. Number 5. What is not a factor to select candidates for nursing programs? A. GPAs. B. SAT scores. C. Community service scores. D. Appearances. The correct answer is D. Appearances. Explanation. Nursing programs consider many factors when deciding which candidates will be accepted. In general, nursing programs will consider a candidate's GPA, SAT, or ACT scores, writing ability, community service, interviews, references, and entrance exam scores. Nursing schools must often set high standards for admission because of the number of students attempting to join the program. Each program can only accept a certain number of students, making it a highly competitive field. High GPAs and test scores are all key factors in the selection process. They indicate that a candidate is studious and dedicated and will do well in rigorous nursing courses. Candidates should also be able to provide a list of references, usually people to whom they are not related. References should be people with whom the candidates have worked, such as teachers and employers. Number 6. What may not be included in nursing school costs? A. Uniforms. B. Daily meals. C. Vehicle insurances. D. Books. The correct answer is C. Vehicle insurances. Explanation. In addition to the time commitment required, when entering a nursing program, there is a large financial investment involved. Nursing school costs, in addition to the obvious tuition cost, can include many fees, room and board, daily meals at clinical sites, books, uniforms, and malpractice insurance. Students will also have to purchase nursing supplies, such as stethoscopes, bandage scissors, and thermometers. Students must also consider the cost of vehicle maintenance, personal health costs, and the costs of life outside of nursing school. Number 7. What is not included in the principle of beneficence? A. Heliocentric theory. B. Hume's theory. C. Kant's theory. D. Utilitarian theory. The correct answer is A. Heliocentric theory. Explanation. There are 3 theories regarding beneficence: Hume's theory, utilitarian theory, and Kant's theory. Hume's theory is that the motive behind an act of kindness determines the validity of the act. Utilitarian theory states that beneficence is simply the drive to create happiness through kindness or unhappiness through unkindness. Kant's theory states that beneficence is motivated by a sense of duty. Number 8. What is the main focus of the principle of justice? A. Discrimination. B. Equality. C. Materialism. D. Tolerance. The correct answer is B. Equality. Explanation. The ethical principle of justice centers on the fair and equal treatment of all individuals. Nurses must constantly evaluate their own motives when treating patients. Each patient should receive the same degree of attention, compassion, and care. Number 9. What do medical facilities do to uphold the principle of autonomy? A. They teach patients medical lessons. B. They reduce healthcare costs. C. They hire qualified doctors and nurses. D. They provide patients with informed consent documents. The correct answer is D. They provide patients with informed consent documents. Explanation. Medical facilities often attempt to uphold the ethical principle of autonomy by providing patients with informed consent documents. Autonomy requires that patients be allowed to decide and act without pressure or coercion from another party. Number 10. What does euthanasia refer to? A. Death. B. Diseases. C. Medical treatment. D. Life expectancy. The correct answer is A. Death. Explanation. Ethical concerns include euthanasia, the definition of death, death through outside intervention, and the handling of patients with diseases brought about by avoidable behaviors. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.